Yesterday I didn't get time for the acne, so to talk about acne. So today I'll be talking about it. So let's start with what is acne and its types. This video will be only about acne and the types of acne. So acne, like everyone knows, they are called blemishes, they are called zits, they are called pimples. So those are the common terms that are used. It is basically an infection or inflammation of the hair follicle and the accompanied sebaceous gland. Sebaceous gland means the oil gland which accompanies the hair follicle. It is an overall infection, inflammation of that entire unit under the skin. So basically what happens why pimples occur is because of too much of oil production, and there is a clogging of the dead skin cells and oil in that entire the duct which throws out the oil in the skin time to time. That's a normal process, but when there's too much of oil coming out and if there is a clogging in that duct, then it causes inflammation, redness, overcrowding of bacteria in that pore, and then it leads to pimples. Now, types of acne, there are many types of acne. There are, based on the type of acne, we usually do the staging of acne, whether it's a stage 1, it's a stage 2, stage 3. So that is not important for you guys to know, but the types of acne, at least you should know that when is it important to go to a doctor and get it treated. So for that I'll be talking about the types of acne. So the first type is a blackhead. The blackheads are, like everyone knows, it is you can see it is basically an open comedon. Open comedon means a blackhead. It's blackhead and whiteheads are called comedons. So an open comedon means where the pore is open, but the entire pore inside within the passage of that pore, it is clogged completely, but the pore is open, the opening is not clogged. So that is why you see a black spot over it. So that is a black comedon. And then there is so it is easy to squeeze a blackhead out. You shouldn't do it because it can lead to scarring, but blackhead is easy. People usually squeeze it out, and I've even heard people saying that they like squeezing out blackheads. So that is one type. The second type is a whitehead. So whitehead is a closed comedon where the pore is also clogged and the entire duct is clogged. So it is very difficult to squeeze it out or extract it. We usually don't do it because it can lead to infection passing through deeper in that entire unit. So that is why that's a closed, so it's not easy to squeeze out a whitehead. So that is a whitehead. That's a second type. When you have blackhead and whitehead, usually we say you are in the stage 1 of acne, where because and it's easy to treat that stage because you just maybe only medications will work in that, creams or the creams that you get, and a good cleanser. This will help in clearing out those whitehead blackheads. But sometimes you might require chemical peels. Even in that case, some people have a lot of blackhead whiteheads, then we need to do an extraction after chemical peels and all. Then third type is a papular type. Papular is a small red bump, that usual normal pimple that you see people have, red bumps here and there, normal red bumps, slightly painful. So that is a papular type. That's the third type of acne. Then you have pustular type. Pustular is where there is bumps, big bumps, but you have pus filled in it. So that is a pustular type. That is again, so when you have blackhead, whiteheads, and you have the papular or pustular type, you are in the stage 2 of acne. So stage 2 also, sometimes medications work, antibiotics and creams and all, but mostly like a person who comes to me with the second stage of pimple, I will definitely suggest for chemical peeling and at least a chemical peeling and extraction along with the medications, of course, the creams and antibiotics. So the process of that, it will get cleared faster. Otherwise there are chances of going into the next stage and then causing a lot of scarring and all that. So better to go for chemical peels and get it cleared faster. Then there is the other type after the papular. So we finish with 4 types. So the 5th type is a nodular type of pimple. Nodular are big bumps where there will be flesh, skin colored, or they can be a red colored bump which is much deeper. You can feel like when you hold it, it's not only on the top of the skin, you'll feel it, the entire area is filled, it is hard, and sometimes there is a lot of pain. And so in that case we cannot extract that. We'll require a lot of treatment process. We might require even retinoid tablets which will go on for longer process, and that's a very difficult stage of acne to treat. It takes some time at least. Then 3rd type is a cystic acne. Cystic is again big, deep infected, the entire unit is infected of the hair follicle. It's not a small pore is clogged or nothing. This is not only clogging, your inflammation, infection, everything is taking place, and it's very painful. There will be pus filled into it or fluid, so you can feel it, there's something inside. You can and you should never ever squeeze out or try to fidget break with a nodular or a cystic acne, because that can lead to very bad scarring. That is really difficult to treat. So these are the types of acne. Now the next video will I'll be talking about the causes of acne, then subsequently maybe the treatment. So here are the types of acne that when you have a nodular or a cystic acne, that is mostly a 3rd stage of acne, and that is like very difficult to treat. Here treatment will involve medications, peels. Sometimes we even give intralesional steroid injections with a diluted dose of steroids. We'll have to inject it within the cyst or the nodule, so that the cyst and nodules, they shrink from within, because we can't extract it or wait for it to break, then it will lead to very bad scarring. So we try to inject steroids in it, and it will shrink from within and it will go off. So, and of course other treatments will also be going on, like peels, and laser also might be required in some cases, laser peels, and retinoid tablets and all that. So that's the 3rd stage of acne. Then 4th stage is where there is bad scarring also that has occurred along with pimples also coming up. That's the 4th stage of acne. So most of all, any stage of acne, patients who come to me, I prefer to start with treatment. But the first stage is very easy to get treated. Even with creams it might go. So 2nd, 3rd and 4th you need to go to a dermatologist and get it treated. That's the best way. Or you might end up getting very bad scars, and that's difficult to treat. So that's it about types of acne.